Dr. Conrad, the truth about size. Let's talk about something 90% of men think about, but nobody wants to discuss. And no, I'm not going to sell you pills or miracle creams. I'm a urologist, and I'm about to tell you what actually works and what's complete BS. First, let me be clear about something. If you think I'm here to judge you, you're wrong. In my 15 plus years as a urologist, I've had this exact conversation thousands of times. And here's what nobody tells you: this anxiety is real, it affects real people, and it deserves a real answer. But here's the other truth bomb. Most of the solutions you see online, they're designed to take your money, not solve your problem. So let's cut through the noise. Before we go any further, let's talk about how this is actually measured, because I guarantee most of you are doing it wrong. Medical professionals measure in one of two ways: erect length or stretched length, that's fully extended while flaccid. And here's the key: you measure from the pubic bone. Yes, that bone you can feel all the way to the tip, not from where the skin starts. You're literally pressing a ruler into the bone. And here's something they don't tell you: your measurements will vary. Cold room? Shorter. Nervous? Shorter. Aroused and confident? Longer. It's biology, not magic. Now, I need to address something serious. There's a real condition called small penis anxiety. It's a form of body dysmorphic disorder. This isn't a joke. This is men who are average or above average, but their brain tells them they're not. If this sounds like you, if you're obsessively checking, measuring, comparing multiple times a day, listen to me carefully. Doing these techniques won't fix the anxiety. That's a mental health issue that needs professional support. The problem isn't your body, it's how your brain is processing reality. And there's zero shame in getting help for that. But for everyone else wondering, is there anything I can actually do? The answer is yes, and it starts with stuff you can do today, for free. Here's something most guys don't realize. You might already have more length than you think. See this area right above your pubic bone? That's called the fat pad, or what some people call the fupa. As you gain weight here, it literally buries your penis. You're not losing length, you're just covering it up. Think of it like this: you have erectile tissue that extends deep into your pelvis. When you were 20 and lean, you could see more of it. Now at 35 with 20 extra pounds, that same penis looks 2 to 3 centimeters shorter. The fix? Lose overall body fat. You can't spot reduce, but here's what works: resistance training, cardio, high-protein diet, whole, unprocessed foods, fiber-rich vegetables. Drop 15 to 20 pounds, and you might literally gain an inch without changing a thing about your actual anatomy. This one's embarrassingly simple. Manscape. Pubic hair creates a visual illusion. It hides the base, makes everything look smaller. Trim or shave, and you instantly reveal more of what's already there. But, and this is important, if you're diabetic with poor blood sugar control, be extremely careful. A nick in this area can lead to a devastating infection called Fournier's disease. If you're in that category, talk to your doctor first. For everyone else, clean up the landscape. And the landmark looks bigger. Simple physics. Here's something most guys don't connect. Chronic anxiety literally shrinks your penis, temporarily. When you're stressed, your smooth muscle stays contracted. Less blood flow, less relaxation, smaller appearance. It's not permanent, but it's real. Plus, and this is crucial, if you're not getting nighttime erections, that's your body's natural maintenance system. Those erections keep blood flowing, prevent scar tissue formation. No nighttime erections over time, that tissue can scar down and actually reduce your length permanently. So stress reduction isn't woo-woo nonsense. This is what helps. Exercise, meditation, therapy, better sleep, maybe medication if needed. This is real physiology. Less stress equals better blood flow, equals better erections, equals better size. Now let's talk about what doesn't work. Pills, scam creams, scam magic supplements, scam. There is no pill that elongates your penis. Full stop. Save your money. Now, some supplements, and I've covered this in other videos, can improve erection quality. Better erections might make you seem bigger, because you're actually getting fully hard compared to before. But that's not adding length. That's just unlocking what was already there. If someone's trying to sell you a miracle solution, they're selling you hope, not results. Look, I get it. This topic is loaded with insecurity, shame, and billion-dollar industries ready to exploit that, but the truth is simpler than you think. Most guys are normal, most guys are fine, and the things that actually work don't require magic. They require self-care. Lose weight, trim up, reduce stress, fix your erections. Do these 4 things, and I guarantee you'll see improvement, not because you've changed your anatomy, but because you've stopped hiding it. And if you're still obsessing after all this, that's not a size problem. That's a mental health opportunity. Get help. You deserve to feel confident in your own skin. Now, I need to address something serious. There's a real condition called small penis anxiety. It's a form of body dysmorphic disorder. This isn't a joke. This is men who are average or above average, but their brain tells them they're not. If this sounds like you, if you're obsessively checking, measuring, comparing multiple times a day, listen to me carefully. Doing these techniques won't fix the anxiety. That's a mental health issue that needs professional support. The problem isn't your body, it's how your brain is processing reality, and there's zero shame in getting help for that. But for everyone else wondering, is there anything I can actually do? The answer is yes, and it starts with stuff you can do today, for free. If this helped, smash that like button so more guys see this and stop falling for scams. Subscribe for more no BS medical content, and drop a comment if you want me to cover the surgical and device options next. Because yes, those exist too. I'm Dr. Conrad, and I'll see you